Good morning. My name is Boster with the Ohio Health MS Center, here for an impromptu educational opportunity talking to you today about bladder hygiene. Again, I want to focus on healthy habits to improve bladder function in the setting of multiple sclerosis. Simply put, many MS patients suffer from some type of bladder problem, whether that be a big floppy bladder where you can't get the urine out, or a tight little racquetball bladder where you're constantly peeing. But patients experience bladder problems. Upwards of 70–80% of all patients will have some problem. And so I think discussing good, healthy habits is an important idea. Number one, most MS patients with bladder problems shy away from water, and that's the wrong way to go. We need to increase our fluid intake. We need to constantly be filling and flushing the bladder. And so I would recommend that you have a glass of water with each meal. It doesn't need to be a big glass, just a little glass of water with breakfast, lunch, and dinner. And then I'm going to ask you to drink a glass of water between lunch and breakfast, and between breakfast and lunch and dinner. So adding in some water throughout the course of the day is very important, and it's our first step in actually improving bladder function. It sounds paradoxical, but please trust me, it's a very important first step. The second thing we need to do is talk about when we drink our water. You want to put 2/3 of all the fluid you're going to drink in the first half of the day. In other words, we want to stack the first half of the day when we're really drinking, and the second half of the day we're going to shy away. I would try to put a relatively hard stop in the fluid intake after the dinner hour. This is because we don't want to be pounding fluids as we get ready to enter the bed, right? And so drinking fluids throughout the day, but the first half is really where you want to focus your attention. Number three, avoiding bladder irritants is important. Many of us drink caffeinated pop. Pop is irritating to the bladder. Alcohol is also irritating to the bladder. And so if we're having bladder problems, shying away from sodas and shying away from alcohols is an important piece. The next thing that I want to talk about is timing voids. This is a really important point. And if you're having trouble controlling your bladder, I want you during waking hours to get in the habit of scheduling a time to go potty. At first it might be once every hour. Every hour you go and see if you can urinate. And if you find I never need to go in an hour, try to go every 2 hours. The idea here is that you want to be in the habit of scheduling your voids so that you don't have a surprise. If every 2 hours you empty your bladder, you're not going to have an oh no moment when you feel like you need to go really badly. Scheduling your voids is a very important idea. The next topic that I want to bring up is constipation. If you're constipated, you're going to have trouble with bladder. And so we've done another broadcast earlier this year where we talked about bowel hygiene and how to deal with constipation. And addressing constipation is another very important part of this whole picture. So in a nutshell, bladder is important. Drinking adequate water is important, and doing it the first half of the day is important. It's important to time your voids. It's important to avoid bladder irritants and to control your constipation. My name is Boster. Thank you for tuning in with us here at the Ohio Health MS Center, where we talked about healthy habits, specifically bladder hygiene.